This is Alyssa Nitschke, and this is my MSN capstone project on increasing nurse retention. So, nurse retention is so important because it's directly related to patient outcomes. So, areas with low turnover rates have decreased hospital acquired health conditions. So, patient outcomes are better when retention is higher. So, with baby boomers now leaving the workforce, millennials account for about 30%. And when looking at kind of how they view their jobs, 45% only report they're engaged in their current roles. 30% will leave their position within 1 year, and 57% will leave their current position within 2 years. And low retention rates really do indicate poor work environment. So when they've been studied, high turnover rates are linked to a negative work environment, poor communication with management, feeling overworked, lack of role clarity, and job dissatisfaction. However, team training does offer a possible solution to kind of help improve actually all of those things. The Team Steps program specifically is one that was developed by the Department of Defense and the Agency for Healthcare Research and Quality. It was created to enhance teamwork and communication. It's been studied by several different hospitals of different sizes. One did show a decrease in patient safety events, and the staff had better attitudes and perceptions of team behaviors after completing it. Another study showed improved teamwork, and they found that they were operating at higher levels of efficiency after completing this program. So the stakeholders for this project, so stakeholders are really important to the success of a program. So one study did look at barriers to success, and one of them that they found was lack of administrative support, and then also just inadequate instruction and simulation practices. So we'll really need to identify the proper agents, champions, or coaches, and these people are going to be people who are well respected, cheerleaders for the organizations, and credible to help kind of promote buy-in from staff. So the key stakeholders for this project, so of course nursing management. So the unit manager and the nursing director will kind of be responsible for the project vision and implementation. We'll ask for volunteers from nursing staff. We really want all areas to be represented. Day shift nurses are going to have a different perspective than night shifts. So we want to make sure that everyone is accounted for. We will want this to be interdisciplinary to make sure that all perspectives are considered. So even though what we're looking at is nursing retention, what we're wanting to do is improve teamwork within the unit. So and teams with greater diversity have been shown to have improved problem solving capabilities. So having kind of the nursing, the support staff, physicians, respiratory therapists, physical therapy, and occupational therapy, all the people who are working together on a daily basis, having all their perspectives considered will help kind of come up with the better solutions. So leadership and management strategies. So one study actually did use this to implement the Team Steps program. So the Kotter's 8-step change model. So first is creating a sense of urgency. So just presenting these problems as opportunities for change to staff. Creating a team, so making sure that there's effective change leaders. So kind of like we talked about, people who are credible to help promote buy-in. Develop a vision and strategy, just making sure to communicate goals so that everybody knows kind of what the aim of this project is. Communicate, making sure that there's full transparency. It really helps to develop buy-in from staff. 5 is empowering others, removing barriers as they're identified, and rewarding change agents for their participation. 6 is short-term wins. So of course we have our long-term goals we want to reach, but creating those short-term goals that are achievable kind of helps create motivation to help kind of get staff to kind of want to keep working on it. 7 is persistence. So just making sure that once this, the program is done, that we don't just drop everything that was learned. So just keeping up with it to reinforce that change. And then 8 is to create a new culture. So just any of the outcomes or things that were identified through this, we just want to make sure that those are the new norm. And if it's successful, then for example, we would want to make sure that all new staff would complete this program as a part of their orientation. So policy implications for this project. So nurses really do have a unique perspective to influence change. We're the ones who are working and who know the problems, and this is our area of expertise. Over the past few years, with the pandemic, the nursing shortages have really been publicized, and it's really been an area of high media attention. But ultimately, what's been caused by these shortages is unsafe patient ratios. So we know that patients who are lacking sufficient nursing care are at higher risk for adverse events. And it all just kind of has a domino effect because poor work environments contribute to these nursing shortages. It causes more nurses to leave. So when there's not adequate staffing, nurses aren't able to do the job that they feel morally obligated to do. So they can cause moral distress and burnout, and then you see nurses leaving the bedside because of that. So it kind of all has a trickle down effect. So a proposed policy change for this would be there. Currently, California is the only state that has staffing ratio laws. So, I mean, any Medicare-funded institution, they have to have adequate amount of nurses, but it's open to interpretation. So really the only way to kind of really influence this is to have state mandates for staffing ratios. So some of the proposed policy implementations for this would be, of course, the mandated nurse-to-patient ratios, and then public reporting of staffing plans, just to make sure that this is public knowledge of how hospitals are staffing, and then nursing staffing committees as well. So ways nurses can be involved. So nurses are strong advocates. That's, a really big part of our nursing process. So we can be strong advocates for change. There is the Yoder-Wise model provides a framework. So if nurses want to kind of really get involved at the state level, they can. Social media is kind of a newer one, but there's more and more nurse influencers, and they can really use their platform to impact policy change as well. So the metrics that we want to use for this would be, so the first will be included in the Team Steps program is a teamwork perceptions questionnaire. So we'll want to do this before and after as a part of the program, and then we'll do it again in 6 months just to see for sustainability. So what we're looking at is team function, mutual support, and communication. The other thing we want to look at is the NDNQI survey. So this is a nursing quality survey. So we'll want to do this just at some point before we do the program, and again probably 6 months to a year afterwards, just to see if there was any improvement in nurse satisfaction. So what we'll be looking at for that one is nurse manager ability, leadership, supportive nurses, the nurse-to-nurse interaction scale, job enjoyment scale, and RN job plans for the next year to look at kind of intent to leave. And then of course we're looking at increasing nurse retention to then ultimately improve patient outcomes. So we'll want to look at the hospital dashboard reports that are put out for hospital-acquired infection rates, length of stay, and readmission. So when looking at our teams, we know that diverse teams that better represent populations, they can better represent the health disparities. So in putting that on our team, we'll want to make sure that our team that is kind of making these decisions and implementing these things reflect the the teams who are working. So we'll want representatives from day and night shift, like we mentioned, and different disciplines as well. So because our secondary goal is to improve patient outcomes, we just always want to make sure that we're promoting and encouraging diversity and inclusion to make sure that our staff reflects that as well, because that also enhances patient outcomes as well. So some strategies for this, how we will accomplish this within our team. So we'll first ask for volunteers, and then we'll kind of have to look at the group and see which areas are lacking representation, and then see if we can ask people to join to make sure that we have a very good interdisciplinary approach. It really will just help with the teamwork and kind of develop clear roles and responsibilities. So there will be an organizational hierarchy, but the key players will be, as we mentioned before, but each of these disciplines are the ones who are involved in the day-to-day care, so they can best represent their needs and look at the kind of areas for improvement. The long-term goal for this project will be to have it be a hospital-wide thing we'll implement, but we want to look at a kind of a pilot unit first. So what we'll be doing is in an intensive care unit. So this is a level 1 trauma center with all different types of patients. And we'll be tracking patient outcomes specifically related to patient safety, So we'll be looking at hospital-acquired infections because we know that these have a high mortality rate. 1 in 17 patients will die. Decreased length of hospital stay, and this is why this is important, is these are linked to high costs and poor patient outcomes. And readmissions rates as well. They do reflect poor care, and they do reflect poor patient outcomes with high financial cost as well. So our communication plan, so at first we'll meet weekly. There will be an in-person or virtual option. If unable to attend, the meeting minutes should be reviewed. The expectations will be communicated clearly. Anyone who wants to be on the committee does need to keep up to date with where the project is at. Any barriers or problems should follow the proper chain of command. It should go to the project lead and then to management. All decisions will be made as a group, but if there's any discrepancy, management is the ultimate deciding body. For our dissemination of results, so we'll be having IT help us make dashboards. So what we'll want to be looking at is before and after to show effectiveness. So for the NDN-QI dashboard, we want to look at satisfied versus unsatisfied employees. So for example, we'll look at the percentage of nurses who feel leadership supports nurses and those who don't. And then the Team Steps questionnaire as well. So for health outcomes, so we know that there's a strong correlation between a poor work environment and poor outcomes. We also know that a poor work environment also has a high incidence of low retention, which then has issues with staffing as well. So when looking at staffing ratios and how that influences patient outcomes, so each additional patient to a nurse assignment can actually increase mortality by about 19%. Additionally, each patient added to a nurse assignment adds a 3% increase of missing nursing cares. So really what we're aiming to do is to increase nurse retention to help improve the nursing shortage, which then will positively affect nurse to patient ratios and then thus kind of improving our patient outcomes as well. So it all kind of ties together, but our ultimate goal is to, increase patient safety and improve our patient outcomes.